Hi, my name is Caitlyn Guthrie, and I'm here today to talk to you about the disease of addiction. Addiction has always been a large controversy when it calls mental health and choice into question. I'm speaking today for everyone and their loved ones who have ever experienced or battled the disease of addiction, and to tell you that addiction is a deadly disease, not a choice. I will also be discussing how the mental illness of addiction is very accurately reflected by the unrehabilitated prison population of addicts and why this makes rehabilitation such an often overlooked aspect of the criminal justice system. According to the American Addiction Center and the National Survey on Drug Use and Health, 21.5 million Americans aged 12 or older battled a substance abuse disorder in the year 2014. The Substance Abuse and Mental Health Services Administration published in 2014 that almost 8 million American adults battled both a substance abuse disorder and a side-by-side co-occurring mental disorder at the same time. Addiction has been considered to be on average about 60% heritable most of the time. Genetics and environmental factors, which cause up the debate of nature/nurture, why somebody is the way they is, are thought to play equal roles in the onset of addiction. Now, let's discuss the addicted prison populations. According to NCAAD, about half of the population of American jails and prisons suffer from the disease of addiction. Around 3/4 of individuals who are in a state prison or jail who struggle with mental illness also struggle with substance abuse. Very few of these addicts behind bars receive adequate means of rehabilitation, for they are only viewed as criminals for what they have done. In 2013, only 10.9% of the individuals who needed specialized treatment in a facility for substance abuse or chemical dependency received it. Many people do not understand why others would go down such a dark path. Little do they know that the biggest mistake they could make is believing the assumptions that addiction or chemical dependency is a choice. Many people, often lacking knowledge on the subject, believe that those who use substances simply lack willpower or morals. Addictive drugs can rewire or deplete the chemicals in a person's brain completely to the point where it makes stopping almost impossible. It is much larger than simply making the decision to end the usage. Treatment of addiction takes many, many years, and recovery often lasts a person's entire lifetime. There's a saying that goes, once an addict, always an addict. And this isn't for the reason that addicts are bad people or lack willpower or morals. It's just that the fact, if somebody is genetically predisposed to the disease of addiction, they are also at risk to struggle with cravings for their entire lifetime. And this treatment takes many years of intensive therapy, attending meetings such as Alcoholics Anonymous and Narcotics Anonymous, or even medication. And in order to help those who are still battling addiction, we must acknowledge that it is an epidemic, not a choice. We must look deeper into the science behind chemical dependency and treat addicts as patients rather than criminals. After all, the opposite of love is not hatred, but a lack of understanding. Thank you.